So now we're going to move on to caregiver and patient experience. We're going to call Paula, Marianne, Scott now.
I'm going to read mine because I'm a little nervous, so I'm going to be looking down, not out at you guys. This all started when I was going to build a garden shed. And I've been wanting to do this probably for 10 or 15 years. I retired a few years ago, and I decided this was going to be my retirement project. So I dug a hole 10 by 12 to put in about 2,000 pounds of gravel, which I did by myself, no problem. I scheduled the concrete to come on a Saturday so I could get help to do the concrete. Then on Monday morning, the lumber came for the shed, and it's used 2 by 6 by 12 foot lengths. Another 1,000 pounds. I had to carry that from the driveway back to the building site. And I had no problems. I spent 4 days framing the outer walls, and in the evenings, my neighbor came over and we put the walls in place. Saturday rolled around, and again, I had the family come over and help me put the roof on. No problem, everything went well. Monday morning again, I ordered material for the siding, which is board and batten, and it was big. It was 1 inch thick, 12 inches wide, and 16 feet long, another 1,000 pounds. My son-in-law did come and help me move that. We moved about half before he had to go to work. We did that. When he went to work, I started to put up a couple of the boards, and it was still pretty sloppy and wiggly, so I went in my truck and I got some 4 by 8 sheets of particle board, came back and put them up by myself. It was no problem. Next morning, I moved the remaining boards to the job site by myself, and it took me about an hour and a half. And I was tired, and I went into the house and got a drink and went to the bathroom. Big problem. I started peeing bright red blood and just went on and on for, I don't seem like forever. I thought I was bleeding to death. So I called Marianne at work and we went up to emerge. We waited around for about 4 hours. The doctor finally saw me. He did tests and told me I had a urinary tract infection. Sent me home with prescription of antibiotics. All weekend I was okay, and Monday came around, I felt pretty decent, so I went back to shed building. Then it started again. Back to the hospital, more waiting and more tests. This time they did an ultrasound. During the ultrasound, the technician left the room for some reason, I'm not sure. I sat up and looked at the monitor. I saw a big white patch on the screen. That's when I knew I was in trouble, and I thought to myself, cancer right away. I told Marianne, we drove home, and all the way we worried, I guess, and the next few days I saw my family doctor. He told me there was a mass that showed up on the screen, and my urologist, he wanted me to see a urologist. I went up to see the urologist in a couple of days, and he told me it was a 10 by 11 centimeter mass on my left kidney, and it was probably cancer. He said, if you were my dad, I'd want you to go down, see Dr. Kapoor at St. Joe's in Hamilton. He arranged it 2 weeks later on August 7th, 2013. I met Dr. Kapoor. He confirmed that it was cancer. And he said we had to remove the mass, the kidney, and some lymph nodes. Surgery was scheduled for the day after my 66th birthday. I thought to myself, I'm going to be okay. I've been through open heart surgery 20 years earlier, and I got through that all right. After this surgery, Dr. Kapoor said everything looked fine, but we'd have to see what this CT scan showed in the months to follow. He wasn't going to do any chemo or radiation at this time. We're just going to watch and wait and see what transpired. things seemed to be stable, so I got back to my normal routine. I felt really good, and I suggested to Marianne we go on the French vacation that we had canceled because of my surgery. We went, we had a wonderful time, came back revitalized, and I had to get back to my gardens so I could plant my garlic for the next season. All was good. This December passed, the CT scan showed some problems. The mets had grown, and I had stage 4 cancer in my lungs and abdomen. Dr. Kapoor wanted me to start an oral chemo, and he gave me a choice of Sutin or Votrient, which are targeted therapies. He wanted me to choose. I knew IV chemo was rough because my sister had cancer. He gave us pamphlets on Sutin and Votrient, and in the back of the Votrient booklet, we saw the Kidney Cancer Canada. And Marianne emailed them, and we got a response very quickly, and they were very supportive, and they put me in touch with Wally Vogel. Well, Wally called me, and we had a very long talk, and he told me that he was a survivor of the targeted therapy for 6 years. Nice guy. He gave me a lot of hope. I phoned Dr. Kapoor and advised him that I would like to go on the Votrient because it seemed to have less side effects. We started on 800 milligrams January 16th of 2015. That's the optimal dose. Within a week, my blood pressure had been increasingly alarmingly high. I was getting pounding headaches, diarrhea, nausea. I called the Votrient outreach people. They told me in most cases to just call my doctor. Dr. Kapoor and Cheryl got lots of calls. And they must have got sick of all the questions that I had. He put me on a third blood pressure medicine to bring down the blood pressure, but it kept getting higher. I felt awful. He took me off the Votrient for 10 days, and I started back on 400 milligrams. The blood test came back and showed that I had some toxicity in my liver, and we dropped it to 200 milligrams. All this time I was having vision problems, and my doctor told me I needed cataract surgery. So I went and had cataract surgery, and I had to go off the Votrient for 10 days. A few days later, we went back on the Votrient at 400 milligrams. I had a CT scan within a few days, and Dr. Kapoor suggested I go up to 600 milligrams. I managed the side effects without too much trouble. The last CT scan in February showed everything was well and the mets had shrunk again. Through all these side effects, I had high blood pressure, dizziness, headaches, diarrhea, constipation, mouth sores, nosebleeds, rashes, and a complete loss of taste. I found over the time most of these could be controlled with keeping a food diary, recording what I've eaten, amount of calories, protein, potassium levels, what meds I was on, and my weight. I feel most of my side effects have been looked after. I watch my weight and I exercise to ward off fatigue and boost my stamina. I have charts that I share with all my doctors, and this is good information for them to share with patients. Dr. Kapoor and I have worked very hard to get rid of all my side effects and hit the right dosage for me. But cancer and chemo meds are not what I or most cancer patients want. We'd like researchers and clinicians and doctors to cure it so we can live a normal and happy life with our families.
My name's Marianne Scott, and I'm Paul's wife. We're retired, and kidney cancer wasn't in our plan. It wasn't supposed to be like this. It was our time in life. It was our time to enjoy life and have some fun. Retirement was supposed to be easy, predictable, safe like a comfortable family sedan, blue sky overhead, and clear traffic on the road ahead. Just two older individuals in a familiar role, driving down the highway into the sunset. Learning that Paul had kidney cancer came as a shock. It threw both of us right out of our comfort zone. Immediately, what we pictured retired life to look like took on a very different perspective, and suddenly the plans that we'd made weren't relevant anymore. It's really difficult to describe exactly how that feels to an outsider, because when they look in at you, you look the same. It's just one of those times when words don't do justice to how you feel and how it's changed your life. That comfortable sedan we were driving in suddenly morphed into this big, black, noisy machine with no protection against the weather. Paul found himself plopped onto a driver's seat in front of handlebars on something that he wasn't trained for or experienced at. That machine came with no instruction manual, but scariest of all, it didn't have an off switch. And it seemed to run completely out of control. This cancer machine taking him to places he didn't want to go, and me hanging on precariously with him. When your husband has cancer, it changes how people see you and how you see yourself. It knocks the confidence right out of you. Suddenly, you're in uncharted territory. At first, you wallow in worry, thinking only of the worst-case scenarios. It's a pretty dark place to be. But then you get over it, and you start thinking, wait a minute, this is the man that I love, and he's certainly not going to go through this alone. So in spite of not knowing what the hell you're doing, you jump onto that monster of a machine, and now you're a team. We're both freaked because this is scary and very uncertain. Then if that's not bad enough, all these obstacles spring up in the road in front of you, and you have no idea how to handle them. Obstacles like surgery. This one hits you first, and it's a big one. There's no graceful way to get through this. It feels like you've been in a terrible crash. And even though Paul's had the very best of surgeons and is very well looked after in hospital, and surprisingly is home on day 4 after surgery, the experience leaves us wounded and stunned, each of us in a different way. But you get through it. Then there's another hurdle, CT scans. I don't think these are supposed to be scary or worrisome procedures. So why do I feel like it's the judge and jury that'll pronounce guilt or innocence on him? I play these scenarios over and over in my head as we wait for results. You dread hearing the cancer is spread, guilty. And you hope desperately to hear that the cancer is stable, or better yet, shrunk. The waiting is quite torturous. No wonder you breathe a sigh of relief when you learn that it's okay, at least until the next time, the next 4-month scan. And the trial goes on and on. Then one day, you hear the worst. The cancer is spread, it's in his lungs, and there's a spot in his kidney cavity. Our hearts stop. What do we do now? Dr. K says we have a treatment, oral chemo. Choose Votrient or Sutent. Paul chooses Votrient because it's supposed to have less side effects. It doesn't take long for the side effects to start, and we try to be prepared. We go home and search the internet, and Dr. Google becomes a live-in house guest. We read everything we can so that we can find out about the drugs and the disease, but the knowledge doesn't reassure us. We also read the Votrient booklet that we've been given. We read it over and over again. The booklet has 1 page for very common side effects, another 1.5 pages for common side effects, as if there's some important sort of distinction between the two of them. There's a couple of paragraphs on uncommon side effects and other side effects. And then there's a page labeled Warnings and Precautions. Yikes. After we read this, we're both scared. Paul's worst side effect turns out to be dangerously high blood pressure. but headaches, nosebleeds, stomach pain, diarrhea, fatigue, mouth sores are also troublesome. We make a phone call to Dr. K, and then another, again and again. And I wonder how he feels about patients calling him all the time about side effects. In my mind, I can see him looking at his phone and thinking, her again. But he faithfully calls back, and I always hand the phone over to Paul to talk to him. I don't want him to hear the worry in my voice. After changing his blood pressure medicines and trying different drug combinations, he suggests a 10-day break, and then Paul restarts at a lower dosage. Mercifully, the CT scans show that the lung mets are shrinking, but the one where his left kidney used to be isn't responding. Some good news, some not so good. Paul stays the course with the dosage, and the next couple of CT scans show stability. Then, as Paul said, he needs cataract surgery. He has to go off the Votrient for 2 weeks while the procedure's done. The procedure goes really well, and the bonus is he's feeling really good while he's off the chemo. A CT scan is scheduled 2 days after he starts back on the treatment again. The metastases have grown again. We consider switching therapies. I've heard an awful lot about immunotherapy, but Dr. K suggests that we up the dosage to 600 milligrams. Paul feels the impact within a couple of days, but luckily tolerates it better than expected. The next CT, 3 months later, shows shrinkage again. Yet we're all happy about the favorable CT result. Dr. K also discusses the possibility of stereotactic radiation and makes an appointment for him to see a radiation specialist. Just another hurdle, I say to myself. I was grateful in those early days of learning that Paul's cancer needed chemo, that Kidney Cancer Canada was there to help. They were and still are a lifeline to us. One email was all it took. As Paul said, they even arranged for another kidney cancer patient who had a similar stage of cancer to call him and talk to him. Wally Vogel may never know how much he helped Paul and me. Thank you, Wally Vogel, from the bottom of our hearts. And thank you, Kidney Cancer Canada, for being there when we really needed your support. But regardless of how much information you have, you still feel helpless. Because being a caregiver has sort of an implied responsibility to it, of making it better. And sometimes I feel like I'm letting Paul down. Why can't I make this thing go away? I call it a thing because I hate that word cancer and its connotations. It wears on you, and it probably shows because people are starting to ask me, are you looking after yourself? Because if you don't look after yourself, you can't look after Paul. And I realize that they're right. Luckily, I'd started a writing project before all of this started. I write fiction because reality is still too raw and scary. And besides, in fiction, I can control the villain and determine his fate. The good thing about writing is that I'm never really far away if Paul needs me, and it does help. The change of focus gives me some energy back, and the momentum makes me brave. I decide I can do more. I get involved and volunteer with Kidney Cancer Canada and CanCertainty. Paul does too. The book gets written and published, and we decide that the book launch should become a combination with a fundraiser for kidney cancer research. It may not be much, but at least we're doing something. It's funny how taking on more at a time when you think you can't do any more actually makes you feel better about an awful situation. By reaching out and allowing yourself to accept help and support, we also learn that there are other folks out there who have been there and done that. And best of all, they're still here and they look like they're doing fine, even while their own obstacles are popping up in front of them. These days, we make our plans as we go, and I've learned an important truth about obstacles. Obstacles are those frightful things you see when you take your eyes off the goal. So what is the goal? What is it that all kidney cancer patients and caregivers want? I'll bet it's the same secret wish we all have. What we really pray for is a CT scan with the letters NED stamped across it. NED, no evidence of disease. That's what I want. I want Paul to get an NED from a future CT scan. Better yet, give us a cure so we can get off that cancer motorcycle and back into that comfortable family car. Kidney cancer patients don't think that that's too much to ask for. And I'm willing to do my part to move treatment to a cure. I'll keep volunteering, advocating, and fundraising. Every day I use social media to get the message out. We need to keep moving forward with kidney cancer research and pressing for improved cancer health care. Patients and caregivers' messages make strong impressions, so come on over. We'd love to talk to you. Thank you.